Welcome to Vital 100, the podcast designed to take your health to the next level.
Hello, this is Dr. Bob Johnson with Vital 100. This is an interview I had with a very good friend of mine, Dr. Eugene Sambotaro. This interview was about 6 months ago, and I know him because we have taken many courses together, and he is a very stellar clinician who practices in Columbia, Maryland. He is going to discuss sleep apnea and the risk factors to sleep apnea, a very critical topic. He's going to talk about treatment options and the structural factors that go into diagnosing and treating sleep apnea, and also the new research. I hope you enjoy this interview with Dr. Sambataro, and remember to enjoy the journey. Hello, Dr. Bob Johnson here again, and we have a very special topic this evening. It's going to be about a topic that is very prominent and brings about a lot of health issues, and so that's why I wanted to bring on not only a good friend of mine, but a colleague who is an expert in this topic, and the topic is about sleep apnea and reduced amount of oxygen in our bodies and what health issues it causes. First of all, going to have introduce Dr. Sambataro, and Dr. Eugene Sambotaro practices in Ellicott City, Maryland. I'm going to have him talk a little bit about himself, and then we'll talk about sleep apnea. Hello there, Dr. Sambataro.
Well, hi, Dr. Johnson. Thank you for having me on your show tonight. I appreciate it. It's very exciting.
Could you tell us just a little bit about your background and how you got into sleep apnea and associated topics?
Absolutely. And as you know, we've been friends for a long time, and we've all kind of grown together, and it's been quite an evolution from where we started as practicing, traditional dentistry coming out of dental school in the late 70s, early 80s. And it wasn't until about 6 years later that I learned about the dangers of mercury amalgam. But that was just the beginning of my journey. So later on in my career, it became clear to me that if I was going to treat patients for orthodontics, I really needed to understand the temporomandibular joint and how it functioned. So I started studying that. And then it wasn't too long after that where actually you and I, we'd already known each other, but we started pursuing very similar interests, and that was the effect of the craniosacral system on a whole, not just whole body health, but in relationship to the bite and the TMJ. And then that just led to the next thing, which was and we discovered that when we look in a patient's mouth, it's pretty apparent if you're skilled and trained that there are lots of clues when we look at a patient's mouth as to the potential possibility of them patient having sleep issues, including sleep apnea or other sleep-disordered breathing. I know that's a long story to get to that end, but that's what really got me interested, is that it didn't make sense for me to be practicing dentistry without evaluating patients' airways.
I think most people do not recognize sleep apnea, which we'll talk about. What they do recognize is if they're a snorer or their partner is a snorer. Can you talk a little bit about the dangers of snoring?
Actually, the real danger is really the annoyance to the partner, although there are some recent studies to show that there can be auditory changes to your partner because of the decibels that are actually occurring during snoring. The second danger, I guess, is loss of your partner due to aggravation, first sleeping in another bedroom and then potentially breaking up. But from a health perspective, actually that's not the danger. The danger is if you actually stop breathing, which we call sleep apnea. But we know there's a strong correlation between patients who snore and those who have sleep apnea.
So talk a little bit about sleep apnea, mainly focusing on the apnea part, and how is it truly diagnosed?
Well, the only way you can really diagnose, you have to do either a home sleep study or you have to go to a sleep center. There are plenty of sleep centers across the country, but there's now available to do home sleep studies, which most dentists that are doing sleep apnea or treating sleep disorder breathing have access to that, either through their office or through a third party. What that does, the most important piece of that, although there are lots of different parameters, we'll talk about that shortly, most important is the apneic event. And apnea means cessation of breath. So you actually stop breathing. One apneic event in an evening means you stop breathing for a minimum of 10 seconds. And that can occur over and over and over. And that's if it's an apneic score of 1, it means you stop breathing one time in an hour, in a period of an hour. If you have an apneic score of 80, then you can see that can be extremely dangerous. We want to obviously determine how severe the apnea is, how many are occurring, and then the second part of that, which is the hypopnea, and that's what you'll usually see on a test, is AHI, apnea hypopnea index. So apnea meaning you stop breathing, hypopnea means your oxygen levels drop by a minimum of 4%. So that's also obviously very important, because if your oxygen is dropping below a certain percentage, you're not oxygenating your cells during the most critical time while you're sleeping.
Well, it's very exciting and very convenient that people can do this with a home study. What does the home study reveal, or who should be looking into getting a home sleep study?
Well, certainly anyone who's snoring, because you want to make sure they're not having some medical issue like sleep apnea or some kind of hypopnea. That would be the first thing. 2, if your partner is telling you that in the middle of the night you're gasping for air, they're sort of watching you to see when you're going to take your next breath. Of course, the patient who's going through sleep apnea is not aware of it. In fact, many times they deny it. And then, which I think is extremely important, other than having the test, is that what is your energy levels throughout the day? Do you have daytime sleepiness? Are you falling asleep at work? And heaven forbid you're falling asleep while you're driving to work or from work, which is obviously very dangerous. So these people need to be tested to figure out what's going on during the night hours that's making them either sleepy, fatigued, brain fog, and then all the other comorbidities that are associated with it, including cardiovascular disease, stroke, diabetes, hypertension, erectile dysfunction, depression, so on and so on, dementia, Alzheimer's. So these are patients that are at risk, so they all need to be tested to rule out what's going on.
And so what would they do to get a home test done if they have any of these things that you just mentioned?
Well, first they could ask their primary care provider. Their physician may not be treating this, but would be able to refer them to a sleep center or to a board-certified sleep physician. If they don't currently have a physician, or they have a dentist that they feel comfortable with, and they know their dentist does treat sleep issues, or if they don't know, they could ask, as a dentist, are you trained and do you have skills, and what's your qualifications to treat patients with sleep apnea?
Can people actually go and order a test online and do it by themselves at home?
No, there's no, as far as I know, Dr. Johnson, that's not available at this time. Who knows what will happen in the future with the way the Internet's going and the way Amazon's taking over everything. They'll probably have their own home sleep study soon. But
Right.
It really needs to be regulated, because even if you do the study, you're not going to know how to read it. In fact, even though we do sleep studies, we still have to get it read by a board-certified sleep physician to make it official to diagnose sleep apnea.
So let's go into what are the health consequences directly related to sleep apnea. What concerns do people have if they do have sleep apnea?
Well, I think the most important is that it's putting tremendous stress on all your organs and all your cells at a time when our body should be resting and healing. The brain should be detoxifying. We're consolidating memory. As a consequence of this, when we stop breathing or our oxygen levels drop below a certain percentage, we go into a survival mode, as you know, fight or flight. So we're releasing cortisol and adrenaline. First and foremost, that's going to give you high blood pressure. And people have felt this or even said, I wake up in the middle of the night feeling very anxious. So that's, certainly one very easy cause and effect. But the consequences of that include also, as I said, cardiovascular disease. So heart disease, stroke. So a stroke or a heart attack could occur in the middle of the night. That's probably the most serious thing. Most of the other health issues or comorbidities are related more to chronic issues. As I said, hypertension, depression, early dementia leading to Alzheimer's, erectile dysfunction, other things like ADD, ADHD, learning disabilities, and then the symptoms of brain fog and sleepiness. But there's certainly a huge number of medical issues associated with not breathing.
I would also say that indirectly, that if a person is not getting restful sleep, they are a danger on the road or a danger at work. That would be a secondary consequence.
Absolutely. That's probably something that we all need to be aware of when we're out on the road, that there's these other drivers that might be falling asleep, whether they're driving an automobile or a tractor trailer or a bus. We're at risk too, so we got to be extremely defensive. If we're the person falling asleep, we need to get off the road. And I think everyone listening, and including myself, and I'm sure, Dr. Johnson, you've experienced this where your eyes started to close while you're driving and you convince yourself it's only 2, 3, 4, 5 more minutes till I get home. But that is a very risky situation because there have been multiple motor vehicle accidents that included, mortalities, or the person fell asleep and still at the scene will say, I only closed my eyes for a second. And that's all it really takes.
What is the percentage, I'm sure it's an estimate, of people, say in the U.S., that do experience clinical sleep apnea?
What they experience mostly is that daytime sleepiness. They feel brain fog. They feel like they can't function at work. They're tired throughout the day. They can't perform. They will fall asleep as soon as they get home. They may fall asleep in front of the TV. And the interesting thing is they will fall asleep pretty quickly when they go to bed. And they think that's good. It actually should take you about 10 or 15 minutes to fall asleep.
And what percentage do they estimate of people in the U.S. that do actually experience sleep apnea?
I think the current number is about 40 million. I feel like that's undiagnosed. There's probably a very higher number. So many people are a little bit reluctant to admit that they have a problem. They will deny that they snore. They'll deny that they have sleep apnea, especially men. I guess it's sort of a macho thing, a sign of weakness. They don't realize what a risk that they're putting themselves at and their family.
So what you're saying is with those figures, about 1 in 8 may be experiencing clinical sleep apnea that is really affecting their health.
Yeah, that number could be higher because most people, I said, aren't aware of it. What about those who are single or who don't sleep with a partner? And I've had patients that have told me they didn't even realize they had a problem until they went away on a vacation with a family member.
And so it would seem to me that in part of the clinical diagnosis of chronic health problems, people should evaluate whether sleep apnea is contributing to those chronic health problems.
Well, there's only one way to rule it out, and that is to do the sleep study, whether it's a home sleep study or at a sleep center. I think it's worth the small investment to at least rule it out as a possibility because you may not get a second chance, especially if you have a sudden heart attack in the middle of the night. As you know, sometimes that's the first symptom is death from the first heart attack.
So what are the options to treat sleep apnea if you are diagnosed with it or you suspect that you have it?
Well, the gold standard is still CPAP, which is continuous pressure that we all have probably seen and horrified by these masks. So it's positive pressure oxygen being forced through the nose or mouth. It has excellent results because basically what you're doing is forcing oxygen down an impaired airway. So they are getting oxygen while they're sleeping. The unfortunate thing is only about 30 to 40% of those who are prescribed and actually get a CPAP will wear it. So many people are non-compliant. They just refuse to wear it, or they try to wear it. It causes pressure against the face. It will dry out the mouth. Obviously, it's not the best thing for your relationship. There was a comedian, I can't remember who it was, that said that CPAP is a perfect birth control device. You can see why so many don't want to wear it. So the next option, which is why I got involved, is that we not only see these risk factors when we look in the mouth, but we can treat it with an oral appliance. And what the oral appliance does, very basic, it's going to hold your lower jaw forward. Since the tongue or base of the tongue is attached to the lower jaw, it immediately brings it out of the back of the airway, therefore making the airway wider, getting more volume, and assuming that this person can breathe through their nose, they will be well oxygenated, and the compliancy with an oral appliance is much, much higher.
You know, I think for our listeners, it would be good to take a minute or two to describe exactly what is going on when someone is snoring and decreasing their oxygen intake.
So snoring basically means that there's a partial blockage of the airway. So as the air passes through the back of the throat, if the tongue is partially blocking it, it's going to cause this vibration, which we hear as a snore. The more the blockage, the louder the snore may be. If the snore goes completely away, then it's not partially blocked. Now it's completely blocked. And that's what we then get an apneic event, which occurs more often during deep sleep and also during REM sleep, rapid eye movement sleep, which is the last cycle of sleep cycle in which we become completely paralyzed. So as our muscles are paralyzed, since our tongue is a muscle, it just falls right into the back of the throat. So you no longer have snoring. Now you have complete blockage of the airway. What will happen at some point is the oxygen level goes so far down and the CO2 level goes up that we will gasp for air in a survival mode. And then immediately go back into this apneic event and continue that throughout the night. And this is why they wake up and they're extremely fatigued. And there's an amnesic effect associated with so they don't even remember waking up or gasping for air.
Can you identify someone? I know that a higher percentage of sleep apnea patients have obesity because they have fat in their tissues in the back of their throat, but can you identify someone who is more susceptible to it by just looking at them?
Well, certainly the profile that fits at least a severe sleep apnea would be someone who's extremely overweight, so obese person, male or female. Even in someone who has an extremely large neck, like NFL football player, they may not be obese, but they may have a very thick neck. So they're also at risk. But the typical patient is overweight. As you just said, Dr. Johnson, the fatty tissue builds up in the back of the throat, so that further causes a closure of the airway itself. But surprisingly, we see sleep apnea even in thin patients. At that point, it's really a structural issue. They structurally have a very small or thin airway. Quite often, thin women, we see something called upper airway resistance. where the airway is collapsing. They don't actually have sleep apnea. In fact, they might be tested and come back with a score saying that they're normal, but they have all the symptoms that someone with sleep apnea would have. I said the daytime sleepiness, the brain fog, maybe depression, lethargic. We have to reevaluate. So there is something called upper airway resistance that has to be looked at. Unfortunately, there's not a test to determine it.
When you're using a device or a CPAP machine, that really is kind of treating a symptom, but can sleep apnea actually be cured?
That's a very good question, because I don't think that the medical community feels that there's a cure for it. Basically, once you're on a CPAP, you're on it for life. As you know, being a dentist, we have a little different perspective. If we can change the architecture of the jaws by using orthopedic appliances to expand the arches, that we can certainly improve the size of the airway, make room for the tongue, retrain the tongue in proper breathing and swallowing and speaking with things like myofunctional therapy. And the patient now has a much better chance of not having to deal with sleep apnea or a CPAP machine the rest of their life. Also, recently in my office, we started using specific dental laser to use in the back of the throat that heats up. It's not a blade. I mean, it doesn't burn or cut, but it heats up the soft tissue, which is collagen. And as a response to that, the collagen formation starts to tighten up the soft palate. And then over the next couple of weeks, we actually will form new collagen. Shrinking the soft palate will also improve the size or volume of the airway.
And would losing weight, if someone was obese and they lost 20, 30, 50 pounds, does that many times resolve sleep apnea and snoring?
I have seen significant changes with patients who lose weight that are obese. In fact, I always recommend a patient who is obese is to go on some sort of weight management program before I would even make an appliance. Although if they're obese and they have severe sleep apnea, they're at high risk. I'm going to refer them to a sleep physician to get them on a CPAP as a temporary measure until they're ready and committed to, one, losing weight. In many cases, once they do that, no CPAP machine is needed, and of course then they don't need a dental appliance. So, and answer your question, absolutely. That's a pretty challenging, as you know, to get people committed to a weight management program and stay on it.
Well, it might be just the motivation they need to go on a diet and lose weight.
I know that if I was presented with option 1, CPAP, option 2, an appliance, or option 3, losing weight, I definitely would go with option 3, not only because of all the other health improvements, but not having to wear an appliance or use a CPAP the rest of your life is pretty inducive. It would be for me. Unfortunately, not everyone is of that mindset.
I know what you're saying. Let me just take a slightly different track here and talk a little bit about the other extreme, which is insomnia, where people can't fall asleep. Talk briefly about insomnia and how it relates to this whole issue.
Well, there's several different types of insomnia, and they describe it in 3 different patterns. 1, can't fall asleep. This is a person who falls asleep in front of the TV, goes up to the bedroom, and then can't fall asleep. They're laying in bed. 2 is the person who can fall asleep easily, wakes up in the middle of the night, maybe at the end of a dream, might have to get up and urinate, walks back to the bed, and can't fall back to sleep. And this may occur 3 or 4 a.m., and there's lots of reasons we can talk about that, why they can't fall back to sleep. And so they are going to have a very restless night because they didn't get their adequate number of hours. And then the third one, which is kind of counterintuitive, is someone who sleeps 10, 11, 12 hours and wakes up and is still fatigued. I think there's some other very different things happening with that person, whether there's some kind of shift in brain activity or neurotransmitters or there's something else going on. And I think the literature is not clear. But for most insomniacs, they will try all sorts of things. First and foremost, unfortunately, some prescription drug like Ambien will help you fall asleep but will not give you deep sleep. And recent studies show that it could potentially cause dementia or Alzheimer's.
That's reason not to take that unless you're really desperate. And I know that this contributes to insomnia is adrenal issues. People have overactive adrenals when they're trying to get to sleep. And also I know blood sugar issues have a lot to do with poor sleep or waking up. There's many things tied to this.
Yeah, I mean, eating too late, exercising too late, or your, like you said, your blood sugar drops in the middle of the night. Some say, gallbladder issues, which occur around 3 or 4 o'clock. Obviously, stress. If you're in a sympathetic state throughout the day, I mean, you just one of those people can't turn it off. You get to bed, you're exhausted, you fall asleep, you wake up, and you're like full fight or flight. The sympathetic nervous system's turned on, and you just can't quiet it down. And that's probably the worst scenario. And I guess actually not ever sleeping throughout the night is the worst. And there are certainly lots of things that people are trying. Supplements, people do melatonin, maybe some GABA, some other neurotransmitters to quiet them down, change the hygiene in their room, get rid of the TV and EMF, using blue blocking glasses before you go to bed if you're using a computer. There's so much literature out there around the sleep issue. What I discovered is some of these patients who I helped with their sleep apnea, now, because they were oxygenating during the night, they weren't dead tired, they have insomnia. So we traded, but I'd rather see someone with insomnia than sleep apnea because people don't die in their sleep from insomnia because obviously they're not sleeping. You will deal with all the other chronic health issues for sure. And the scary one for me that's highly associated with it, because if you're not getting that deep sleep and REM sleep and you're not clearing out the toxins from the brain, you are on a sure course for dementia or Alzheimer's. And to me, that's, I think and you might agree, Dr. Johnson, and I know we've had this discussion, what would be the worst disease that you could have? And to me, that would be, I think, at the top of the list.
Well, I want to tell our audience that as validation of you being an expert, you actually have written a book which I've read cover to cover and continue to refer to, and the name of the book is Stop the Snore by Dr. Eugene Sambotaro, and I would recommend anybody who is considering understanding their sleep apnea or their fatigue when they wake up should get this book, and it will give you a huge amount of information. I want to thank you very much. What is a contact information for you that people can contact you to be able to have you evaluate them if they so need to?
Well, we do have an assessment on my website. My personal website is Dr. Gene, Dr. Gene, Gene, Sambataro, SAMBATARO.com. So drgenesambataro.com. That is the site where it has the assessment, the sleep assessment for yourself or your partner.
Well, that is certainly good information to know, and anybody who suspects they have it or wants a more quality life should definitely contact Dr. Sambataro. I want to thank you very much, Dr. Sambataro. You've been very enlightening, and certainly there's so much more to know about this, but you have given our audience a lot to think about.
Well, Dr. Johnson, I appreciate the opportunity. Thank you for sharing this with your audience. And you are certainly a pioneer in getting the word out about all these health issues that more and more people need to learn about, because we're definitely in a health crisis.
So thank you very much, and I'm sure we'll be talking in the very near future.
I certainly hope so. Thank you, Dr. Johnson.
Take care. Bye-bye.
Thank you for joining us on this episode of Vital 100. Please check out our website, vital100wellness.com, for other ways to listen to our podcast, as well as additional health resources. If you have questions for Dr. Bob, Or if you have feedback or recommendations for the podcast, please send an email to info@vital100wellness.com.